Welcome to Sheena Says, a podcast about wellness, parenting, and real stories.
Hi everyone, welcome back to Sheena Says. And today I want to talk about children's ear infections, enlarged adenoids, enlarged tonsils. This is a really sensitive, emotional topic for parents, and I want to discuss it calmly and clearly without fear mongering and give you some medical clarity so that you can make empowered, informed decisions. A lot of kids get them. This is not a rare problem. 75% of kids at least have one ear infection by the age of 3. 30% develop recurring ear infections. And the infections are actually the number one reason for kids getting antibiotics. Now, what are the root causes? The root causes for them having these ear infections is the immature immune system, especially under the age of 6. Enlarged adenoids blocking the eustachian tube, poor drainage where the fluid gets trapped behind the eardrum, chronic inflammation, repeated antibiotics weaken the immunity, allergies, mouth breathing, frequent colds. These are all signs that the child's immune system has not been supported. Now, ear pain is different from ear infections, and sometimes they do get both because of the fluid buildup or the pressure. It might result in hearing issues. Not always does it result in hearing issues, and this can happen without having an active bacterial infection. The doctors, when you go to them, most pediatricians tell you it's an ear infection, and their first line is to go ahead and prescribe the antibiotics. But the problem is that that doesn't solve it. It actually creates a negative loop, because then you will notice after giving it that in a few weeks they get it again. The antibiotics can get prescribed, but the problem remains. So the pain doesn't automatically mean that there has to be surgery involved. The ear tubes are suggested when the kids get 3, 4, 5 infections back to back to back, and then there's persistent fluid, and the pediatricians say that, oh, they're going to lose their hearing, so it's best if you just put in the ear tubes. What the tubes do is they drain the trapped fluid, reduce the pressure, and it does improve the hearing temporarily. But what it does not do is fix the immunity. It does not stop future infections and does not address the causes of their low immunity and inflammation. And most kids who do get the ear tubes end up having more infections and have to repeat the surgery. Now, for the adenoids and the tonsils, why are they enlarged? They are, again, immune tissues. They're not useless organs. They enlarge when the immune system is overworked, when the child is fighting repeated infections, when there is a chronic nasal congestion or an allergy. Enlarged adenoids can block ear drainage and cause mouth breathing and lead to snoring and sleep issues or worsens ear infections. Removing them helps the symptoms. It does not help the immunity and the overall functionality. Now, the tonsillectomy and the adenoidectomy, here are the pros and cons. May help short-term sleep apnea, severe obstruction, or recurrent strep infections. However, it does not train the immune system in early childhood, which is super important. The removal does not improve the immunity at all. It only worsens it. And now you have even removed the first line of defense that the child has. So the children get more chest infections, and the surgery doesn't address why the immunity is actually low. The low immunity is the conversation that has been missing. The children with recurring ear infections have low immunity. And what can we do about it? There are immunity boosters that are homeopathic formulations that the kids can take. You can give them echinacea, you can give them elderberry, you can give them multivitamin gummies, you can give them multivitamin drops if they are much younger. You can build their immunity with the immunity booster kit that we have, and you can get professional treatment. There's also a flu pack for general coughs and colds, which works great most of 80% of the time, and any age kid can use it. The trick is into getting them started right away. The minute they have the infection, they have to get on the flu protocols and get on the kit and stay on it till they clear up. The other thing I would advise is immediately stop dairy. If your child is infected with a cold or a cough and they brought it in, they're patient zero, immediately stop the dairy. The dairy consumption only adds to building more mucus and adds to the congestion, which is counterproductive. So you need to stop the dairy, hold it temporarily. You can reintroduce it when the infection is over, and also stop the acid. Do not allow the kids to start drinking juices and drink cold things and eat cold fruits. Again, vitamin C, getting it through an orange when the child has a cough, is not going to cure the cough. It's only going to irritate the throat further. Robitussin and all these cough fluids do not help. The kids will have cough that will continue on for days and days and weeks on end, and then they will pass it on to the other family members and siblings that they have, and then everybody will end up going through this loop and cycle of constantly being on antibiotics for 1 week or 2 weeks, and then after a couple of weeks they will end up on the same antibiotics again. So this is counterproductive. It makes you feel counterproductive because now you're losing sleep, you're losing time, and you're not even getting better. You just keep being on the same antibiotics, which will now disrupt your stomach lining, and you will start having digestive issues, and it goes on and on. Instead of going in that loop, you can actually circumvent all of it. Stop the dairy, stop the acid, use the flu pack to get better, the cough, cold, and fever remedies, whichever one applies, or all of them, and use the immunity booster to boost your child's system to actually take control. There are other kits available for enlarged tonsils as well as adenoids, for sleep apnea, for snoring issues. They can be all addressed and they can all be managed. Most children do grow out of them. It is not something that's going to damage their vital organs like hearing and or affect them permanently unless you allow that to happen. So I would definitely say immune regulation, not suppression, is the answer. Reducing inflammation, improving the drainage naturally, and helping the children gain strength and use their own bodies to fight the infections is the right way of raising them so that they become strong adults. You don't want dependent adults or those who are there whose immune systems are compromised, because they will never come out of that loop. They will then start developing other autoimmune disorders, and if they continue on antibiotics or go the surgery route, that is likely to happen. They already tell you the risks. It's not like they are going telling you, they're blindsiding you about it. So you have to get the right support, and I would definitely say dairy can be a huge denominator as well as culprit in increasing the mucus. So when you cut out dairy from your child's diet, you will immediately notice an improvement. You don't have to cut out complete dairy. They can still eat cheese and they can still have some butter, but I would not give them yogurt, especially in the winter, and I would definitely cut off the milk only till the time that they are compromised, and you can reintroduce the milk back and avoid the yogurt only in the winter. You can have the yogurt during the summertime. Also, there are eardrops that are organic. You get million eardrops. Million eardrops are a great way to go ahead and just maintain your child's ear health. You can just, they're garlic oil drops. You can use these proactively. You can use them reactively. You can have purchase them on Amazon. Amazon carries the million eardrops that are great for ear health. You can also clean the child's ears regularly with earwax. If earwax is building up, that'll be another issue. So what I would suggest, make a 50-50 solution of hydrogen peroxide and water and use 2-3 drops in your child's ears. It will go in naturally, and if they hear a pat 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 sound, that means the earwax is getting cleaned up. And you repeat this once a week or twice in a month. Put in the drops and then drain it out. This will keep the child's ear clean. And at night, you can put in the garlic oil drops, the mullein drops, that will clean up the passageways completely. This will really, really help organically keep their ear health. And if they are continuously falling sick, like I said, give them multivitamin drops, give them gummies if they're older, and seek the immune booster. Look at the website, they have the kits available. The flu pack is also online. Everything is available for you to simply go and purchase it. Try it out. Give your child the best chance at natural health, because then that will carry them forward into adulthood and make them stronger adults. Now, if surgery is imminent, and it is not always wrong, if hearing loss is very prevalent, or they're having severe obstruction and conservative treatment has failed or has not given you the improvement that you were looking for, please consider it, discuss it with your pediatrician. But I would definitely say that should be the last step. It should not be the first step. Unfortunately, the pediatricians normally push the surgery as the first step. That's where I would disagree. I would say give your child the best chance at natural health first. Look after their well being. You're their guardian. It's your job to look out for them. Don't take the shortcut. It's still there. Your option B will still exist. It's not like anybody's taking that away from you. But do it right first. And if that does not take you where you want to go, then go for option B, and this will help them. If the ear keeps getting infected, it's not an ear problem, it's an immune problem asking for help. So please give them the help that they need. Stay well naturally. Until I talk to you next time, thank you for listening.
Thank you for listening to Sheena Says, and for more info, please visit yourhomeopathy.com.